Grandma's in the hospital, but she's called the police. Elderly patients are the majority of patients that we admit to the hospital. We're talking about people over the age of 65. They can come in for anything like a hip fracture to pneumonia, COPD, or even heart failure. Sometimes they'll come in with a stroke. But what we've noticed in the hospital is that when these patients come in, they are vulnerable and actually sometimes will, lack for a better word, go berserk. We're talking about pulling off their IV lines, their telemetry or heart monitors, their oxygen. Sometimes they'll pull off their clothes. They'll fight with people. We're not talking about verbally fighting. We're talking about agitation, fighting with nursing staff, throwing a few punches. Sometimes they'll try to get up out of the bed. They fall. They risk further injury when they do that. And sometimes we've had fractures happen in the hospital because they've fallen because they refuse to stay in the bed. They'll call their family members and tell them to come and get them, and tell them to call the police because they feel that they're abducted, and we've had a few even call the police. What is going on? Acute delirium is a process in which the patient's state of attention is fluctuating. There's a number of symptoms that happen with that, ones that we've listed, but they can go from a lethargic, drowsiness, sedated state to a hyperactive, agitated, combative sort of state. We have two types of delirium. We've got the hypoactive, where they're sleepy, drowsy, it just seems like they're sleeping more. And then we have the hyperactive. You will tell me that your parent or grandparent does not act like this at home. They're normal, they're fine, they don't hallucinate, they're pretty good and independent. Well, again, when they come to the hospital, we get a different side. And it's not that this is unmasking something that is happening at home and everyone's missing it. No, far from it. Patients that usually get admitted to the hospital will sometimes have all sorts of effects just from being in a hospital. This can even happen to younger people. Although we don't understand what causes delirium, we do have a good understanding of what can contribute to delirium, in addition to risks such as being older, having pre-existing dementia, or having even mild memory changes can contribute to this. Being on too many medications, something we call polypharmacy, having uncontrolled pain, being withdrawn from a drug, not getting a drug you normally get, and so forth. Pay attention to a future video in which I discuss numerous interventions that we can perform to help these patients calm down and become more alert and more aware of their surroundings.